Good morning. My name is Debbie Ruggles, and I'm here to represent the Accessible Transportation Coalition. I am also the Assistant General Manager at Tulsa Transit. I want to welcome all of you today and thank you for the time that you are investing today in discussing with us this important issue about walkability in our community. The Accessible Transportation Coalition is hosting, but we have a number of sponsors who have helped our coalition make this dream of bringing this Sidewalk Summit to Tulsa a reality, and we want to thank them for their contributions. A couple of housekeeping things. Number one, if you have a cell phone, if you would turn that to the silent or off position, I would appreciate that. Also, we will be having food and refreshments. There was a little bit of coffee. I apologize for the coffee delay. There was a little bit of coffee. We're getting more coffee, and we'll have additional coffee available during the morning break. But there will be some food and some other light refreshments and drinks during the morning and afternoon breaks. If you need to get out, though, between now and then, certainly feel free to move about and do as you need to do. The restrooms, if you go out this door and to the right, all the way down the hall, you will see the restrooms. So we'll go ahead and begin our day with Dr. Gerry Clancy is here this morning to share a few remarks before he introduces our first speaker of the day. Dr. Clancy serves as the president of OU-Tulsa and the dean of the OU College of Medicine. He earned his bachelor's degree in biochemistry from the University of Iowa and his medical degree with Alpha Omega Alpha honors from the University of Iowa. Please help me welcome Dr. Gerry Clancy.
Well, thank you, and good morning to everyone. I'm glad you're here. It's a beautiful, beautiful day, and it's like this every day at OU-Tulsa. So, so why in the world would a biochemist, physician, psychiatrist be talking to you about walkable communities? And that's because of our mission. In 2008, we changed the name of the OU College of Medicine here in Tulsa to the School of Community Medicine. And our mission is to improve the health of entire communities. And working on this campus, where we have medicine, nursing, pharmacy, public health, allied health, and the physician assistant program, but also architecture, urban design, social work, human relations, computer science, engineering, we realize that there's power when different disciplines start working together on difficult problems. And we quickly realized that if we were going to improve the health of an entire community, it took a lot more than medical students to do it. So we have a campus of interdisciplinary work and relationships and taking on difficult problems. And so Sean's group and the Urban Design Studio is very much a part of our medical school. When we kick off the very first lecture for our medical students during the Summer Institute, their very first sit down and start learning medicine, we actually have Sean Schaefer give the talk. And it's our Summer Institute where we teach them the anatomy of the community before we teach them the anatomy of the body. And Sean gives them a great historical perspective on how Tulsa ended up how it is. And it's one of their very favorite lectures over the next 4 years. So Sean, I know you think it's a great lecture, but, but it really is very, very well thought of. This year we actually did it a little bit different. We put them on buses and went up and down Peoria. And we did the lecture up and down Peoria, teaching them about Tulsa from that perspective. And again, the students absolutely loved it. So let's talk a little bit about walkability in relation to health. So I didn't bring enough of them, but I did distribute. If you guys could share them amongst each other, just so you could show each other, I brought what I call Oklahoma's postcard. This is a postcard of health. And I use this an awful lot to show people where Oklahoma is compared to other states as far as our health. And you see that in, if you look at the Northwest map, you see mortality-wise, we are very dark blue. And on this map, dark blue is bad. we have a much higher mortality rate. If you go walk one over to the right, the north central map, you see that our health system performance is not very good. We're in the dark blue again, and that measures access to care, avoidable hospitalization, unnecessary costs, and the health of the population. If you walk one down to the middle west one, our overall health is dark blue, and that's rated by United Health Foundation. These first two ones are Commonwealth Fund. The next one shows physical inactivity. We're dark blue there as well. Physical, and if you're not physically active, that sets you up to have diabetes, and that's the east middle one here. Well, if you have a higher rate of diabetes, you would expect to have a higher rate of cardiovascular events. And that's the southwest one. And you see that we are in a part where we are dark red here. Here, dark red is bad. And if you have cardiovascular events, you're at much higher risk for cardiovascular death. And that's the south central one. Also, interestingly, these correlates of this, what I call continental divide in the United States, one part of the country being much less healthy than another part of the country, also correlates with high school graduation rates. So if we want to have a vibrant, healthy community, we have to look at the numbers and go backwards. And it really starts with this physical inactivity part, because we don't have very much a culture of health in this part of the country. This part of the country loves its southern food. This part of the country loves its independence. This part of the country has not invested near as much in walkability and has invested much more in cars. And you see at least the health results of that. If you flip over the postcard, where I would normally write you a nice note, I decided to show you where we rank specifically as a city. The graphs to the left show the 306 hospital referral regions in the United States. And here Oklahoma is divided up into three regions: the Tulsa region, the Oklahoma City region, and the Lawton region. On the top of the list of those 306 regions is St. Paul, Minnesota. If you've been to St. Paul, Minnesota and Minneapolis, it's a very health-conscious city. They embrace winter. I was up there, and the ice had gotten thick enough on the lakes, and they were so excited it was time to go ice fishing. I think, you guys are crazy. That's crazy, but they embrace winter. So it's not a winter thing. I mean, one of our northernmost, snowiest, coldest urban areas is incredibly healthy. So beer and cheese is not the reason why Minneapolis is healthier than others. They are very, very active. I'm from Iowa City. We're ranked number 20. A city full of trails. Every neighborhood that is now developed has a bike trail in the back of it. And there's a whole arterial of trails. I could easily walk to work or bike to work with no major interactions with cars. It's really quite wonderful. They've invested and invested and invested. Now, the bottom 10% of these 306 cities has Oklahoma. Tulsa's ranked 281, Lawton's ranked 286, and Oklahoma City is ranked 298 of the 306 cities. If you're a company looking to relocate your businesses, how do you think Oklahoma stands as far as when they start discussing the health of their population? Not so good. So we need to think about this alongside just having a healthy, productive life. Where does this stand as far as economic viability? This curve to the right measures age-adjusted death rates. This one right here. That's a number you want to be as low as possible. In 1968, we were in the exact same age-adjusted death rate as Colorado. And over the next 30 to 40 years, Colorado has improved by about 35 to 40%. Oklahoma has improved only 12%. We've got to think to ourselves, why is that? It's not poverty. It's not drug abuse. It's not methamphetamine. It's the other factors. And part of that is that culture of health. Colorado has invested heavily in a culture of health. And they work very, very hard at it. Getting to a more microscopic level, you have this curve, or this diagram on the bottom. That is Tulsa County. And working with our health department, and Bruce just came in. Bruce, you're a busy man, aren't you? A little bit. Well, welcome, and we won't talk about Ebola at least for the next few hours. All right, thanks. This is a measure of the zip codes, and we had to do this work by hand because this is difficult to do by usual reporting methods, but we looked at life expectancy by zip code, and what we found was a 14-year difference in life expectancy between zip code 74126 in north central Tulsa County and zip code 74114, which is in Midtown. Only about a 5-mile difference and a 14-year difference in life expectancy. Bruce, what is the good news on our 14-year difference in life expectancy, though? Yeah, and some of the indicators we know are improving already. We know that cardiovascular events, we know that infant mortality, and we know that diabetes incidence seems to be improving already between the difference between North and South Tulsa. So something can be done. These are not intractable, unsolvable problems that we have. So that's just to give you the landscape of a sense of urgency as far as health and economics. I know a number of you here are here from the business community. I know Josh is here from Jenks, and a number of you, Delise is here from the chamber as well. We just got back from Portland, and 120 business leaders went to Portland to look at how they are developing their city and how they're so good at attracting young talent. And that's where we come to this other curve, this other set of worksheets that I handed out to you. This curve right here shows from 1900 to 2050 the number of 65-year-olds in the United States. And what you see is exponential growth of 65-year-olds. We are an aging population. 10,000 baby boomers are retiring per day in the United States. That's huge as far as our economic viability, because this next curve shows our labor participation rate. And in about 2000 is when our labor participation rate peaked at 67%. It's been downhill since there. And that labor participation rate is not unemployment as it's falling. That's people retiring. What's most important about that, I mean, we all want to retire, right? Everybody wants to retire comfortably. When we retire, we don't spend as much. And that's what this curve shows. Our peak spending over our lifetime on retail spending, which feeds our cities, is at about the age of 42, 43. So when we retire, we spend less. When we spend less, less goes to the basic infrastructures in running our cities. So we need to either have older people work longer and spend more, or we need to have young talent here that wants to stay and backfill for all of us. And it's probably both, is what it is. So that's why we went to Portland. When we saw Portland, Julie was there as well, we were amazed by their 40 to 50-year investment in walkability, in bikes. Bikes were everywhere, and in light rail. It was very, very impressive. They committed to it 40 years ago, had a long-term plan, and when they put it together, it really worked quite well. We were very impressed by what they were able to do. And hopefully we can be a city like that is attractive to our young people, because our young people want diverse, walkable, bikeable, exciting downtowns, great place to raise their families. We have lots of things in place as far as being able to retain them. But one of the areas that they are most disappointed as far as Tulsa is that walkability, bikeability piece. We've made great progress, but we've got to keep going.